If you look at America as a whole, at any given time, about a quarter of the population is struggling with mental health issues that are being treated. Across a person's lifespan, 50% of individuals will struggle with a mental health issue.
Hi everyone, it's Amy Valdivia, and this is the Just Ask Upland Podcast. We are here to celebrate the Upland Chamber of Commerce and all of the business members in our community. We have been voted number one. That's right, we're the best chamber in the Inland Valley, and I am super excited today because we are here to celebrate one of our great members, former Nonprofit of the Year in 2018-2019 to be exact, Dr. Doug McKown of Samaritan Counseling Center. He's been a member for 17 years, and you're going to be amazed at the information that he's about to provide. Let me tell you a little bit about Dr. Doug. Dr. Doug McKown is a licensed clinical psychologist with over 28 years of professional experience in private practice, university, community, and medical settings. For the last 17 years, he's served as the executive and clinical director of the fully accredited Samaritan Counseling Center. He was awarded, like I said, 2019 Nonprofit of the Year by the Upland Chamber of Commerce. He holds both master's and doctoral degrees in clinical psychology from Fuller Graduate School of Psychology, as well as a master's in theology. Did you hear that? Science and theology clash, and he's going to show us how he puts this into his practice. He's received local and state recognition for the Healing and Saving Children Through Healthcare Award from Campfire USA and recognized by Reach Out for his community leadership. Dr. McKown is a founding member of ExecNet. What's that? It's a collaborative of nonprofit executive directors dedicated to supporting high-performing, results-driven human service nonprofits in our region, and he also serves on the Inland Regional Center Vendor Advisory Committee, serving over 38,000 children in our community. Thank you so very much. He also serves on the Upland Chamber of Commerce Board of Directors, and he chairs our premier event, the Tour de Foothills. Dr. McKown is married for 33 years and has 2 children and enjoys mountain and road biking, hiking, and many other life adventures. Welcome, Dr. Doug. We are so grateful for you being here today.
Thank you. Good to be here.
Tell me about Samaritan. Tell me about your center and how it serves our community.
Well, we're a fully accredited nonprofit corporation. We've been serving the community actually for nearly 50 years, providing high quality professional psychological services. And I have an awesome team of therapists, 19 staff, and master's and doctoral level caring therapists. Couldn't do it without them, and they have specialties in various areas. We provide services across the age range. We have folks that specialize in working with children, for example. We serve a lot of children and families, and we deal with a whole host of psychological issues.
One of the things that stands out to me is, number one, everyone has the education. They have the background knowledge to serve and to ensure that mental health is cared for appropriately. Mm-hmm. There are counseling centers out and about that they may have their heart in the right place, but maybe not necessarily the appropriate education and accreditation behind them. You bring it all to the table, absolutely, and it's fantastic. Which the reason why we're talking today is mental health awareness. May is Mental Health Awareness Month, and it was extremely important to me that we have this conversation because we need to bring this front and center. This topic needs to be brought to our community. They need to understand that we all have good and bad days, but there's more to it when it's bad days more often.
Mm-hmm.
Talk to me a little bit about the history of mental health, the awareness in our community, and what we can be doing to support you.
That's a big question. If you look at America as a whole, at any given time, about a quarter of the population is struggling with mental health issues that are being treated. Across a person's lifespan, 50% of individuals will struggle with a mental health issue. Wow. So it doesn't, I mean, it's pretty simple with the numbers. If you have that high a percentage, then that affects, it's going to affect everyone in the sense that maybe it doesn't happen to you, but your loved one, your spouse, someone at work, someone in a close group. So this is something we have to deal with, and the better that and the more accepting we are of it, then people will access the help that they need. So for us, we have there's a couple of our largest programs. So one is our outpatient program, and that serves people across the age range. If a person has anxiety, depression, relationship issues, that's a biggie, or children with issues, we serve all those individuals. And we also have a specialized program called BEAMS, Behavior Education and Management Services. And that works with families who have children with developmental disabilities. So examples are autism, cerebral palsy, right, Down syndrome, and a variety of other developmental challenges and rare diseases and disorders that people have never even heard of. And that program we operate throughout San Bernardino and Riverside counties. So it's a pretty large catchment area.
There's a stigma behind that. You're serving the family, I presume,
yeah,
correct? As a parent, when someone says, there could be something wrong with your child, instantly, the hairs behind the neck
mm-hmm.
rise, and there's the protection that comes out, and then there could be the embarrassment. Trying to take care of your child, trying to make sure that they are socially accepted outside, and dealing with so many feelings internally. The stigma is what I want you to talk about. How do you support the family in a situation like that with a special needs child?
It's a challenge because, to back up a little bit, you talk about stigma. When we don't understand something, we're uncomfortable with it. When there's something that we just are, it's unknown, it's uncomfortable, a lot of people tend to avoid it, and so you'll see that played out in various ways, whether it's in the public sphere or in a family. So sometimes we'll have parents that they see something and they want help for their kids, and there'll be like a mama bear, and nothing's going to get in between them and getting their child help. And at the same time, you'll have others that it's like there's a certain level of denial. And there's various stages of that too. Sometimes they might start off with denial and then they realize, no, I need to face that. Or you might have one parent that is, we need to get help for our child, and the other parent is in denial. And so those are some of the dynamics that we have to address when we're working with a child. For example, is part of what we do at Samaritan is look at the whole person. So for example, we have a specially equipped play therapy room, Because if you think about it, children don't have the verbal capacity to
Right.
talk about what's going on inside. And so we have all kinds of equipment and toys. And one of the things that we have for young children, and actually older kids can use this and adults can use it too, is a sand tray. So it's called sand tray therapy. That's just one of many specialty tools that we have that we can use. And they can, through the use of figurines, create their world and tell their story through that, for example. And that's a unique part of what Samaritan is about. Mind, body, spirit, and community, mental, physical, spiritual, relational. So it's not just a person with a problem. It's not just a singular, oh, this child has this, and so we just treat that, distinctly, and then everything's better. Most things involve the individual, the people around them, the family, the environment. Those are all factors that we have to take into consideration. We have to take into consideration what's going on for them physically, because they might have a particular mental health issue, but what's going on for them physically? And part of that integrative aspect is looking at, what drives them, what are their beliefs, what's important to them in life. So those are all aspects of addressing issues. And then going back to getting help, we want to be able to make it a safe place. We want the family to be able to come in and get the help that they need. And so that we have to be very creative in terms of how that's approached. Whether it's out in the field, because we do in-home treatment in our BEAMS program, or in our facility.
The holistic approach. In your bio, I talked about science versus theology. When you're looking at the whole person, we're looking at the science, we're looking at the psychology, why they're here. And then, as you touched on, what's their family like? What are their beliefs? You have this education. Number one, I want everybody to know how and why you chose this profession. How and why you chose the education that you have. And then talk a little bit more how all of this knowledge has helped in this holistic approach.
That's a huge question. The simple answer is I wanted to help people. I actually started off in mechanical engineering. I have an engineering mind, but at the end of the day, that didn't flip my switch. I really wanted to help people. I didn't want to work with things. I wanted to work with people. I saw how that can have a powerful effect on people around me, and I wanted to make a difference. So that's the simple answer. How we do it, though, makes a difference. So I wanted to understand how, if I want to help a person, I don't even, how do I go about that? What's going to be, at the end of the day, what's going to be important? And if you again look at the stats, the vast majority of people in the United States believe in God, have a faith, and to divorce one's psychological issues from that doesn't make any sense, because then you're not treating the whole person. So if you want to treat the whole person, if you want to approach the person as a whole person, you've got to look at what's going on with them physically, mentally, spiritually, relationally, their environment. So that's the whole perspective. That's the whole person approach to the treatment. You know, if you want to talk about the healing of persons, that's what I feel very strongly about. So I wanted to make sure that I got the requisite education in order to do that.
So when you're sitting in your theology classes, are you looking at the education that you're receiving? The perspective, is it, this is faith, this is what's happening in society from a faith perspective and why people are approaching issues as such, or are you looking at it from a clinical point of view?
I would say first looking at it from a personal standpoint of wanting to understand my own faith and how I practice it and how I can be a part of helping others. But it starts with me first. So that's the, you know, the genesis of that, if you will, is what is this this faith that I espouse, and then you know, what am I going to do with it, and how do I understand God? How do I understand God in the world, and how do I understand how people's faith affects their daily life, the choices they make, and again, how can that be part of their own healing process? But so I just covered a whole wide range there, but that's where it started from.
This is exactly why you have that award. This is exactly why you deserved it, number one, because I want everybody to hear this. You went to not only make sure that you understood your own faith and why, where, however, you wanted to make sure that if you're serving these people, you needed to understand and have that background knowledge. That's why somebody goes to Samaritan as opposed to another place for counseling. This is why we have you as part of the chamber, and this is why you've been so successful. And I hope the members and the listeners are hearing this, because you approached this very differently than most other clinicians. Oftentimes I've heard, oh, well, you know, a human was created from a speck of dust and the science and et cetera, et cetera. People believe in other ways and in other things. And the fact that they can rely on somebody who has the science but also has the theology background, I believe is the whole package. And I applaud you for that. I think it's awesome.
Thank you.
You talked earlier about our mental health in our lifetime. 50% have some sort of mental health issue throughout our lifetime.
Yeah.
We have dealt with a pandemic. Front and center, all of us.
Yeah.
What I could venture to say, 100% of the population had to deal with some sort of a mental health challenge due to the pandemic.
Most definitely, yeah.
How did you step in? How did Samaritan take care of all of the patients and then some?
That's an excellent question. And lest we forget, we had never in our lifetime faced that. And we had never, because we weren't allowed with all of our funding sources, we weren't allowed to do telehealth. So, and we are all clinicians, but we're people first. So we were in the same boat as, okay, what's going on? Seeking answers. Okay, what's safe? All of that. And I can remember in the days coming up right before things were being shut down, and in the shutting down process, thinking, how do I simultaneously support and protect my staff while staying on mission? How do I keep my people safe and yet provide the services that we're here to provide? And there was a lot of long days and, and sleepless nights. Like, okay, how do we do this? And I remember just right before things were shut down, gathering my staff together for the last time in a big chunk of time, in person, and the look on everyone's faces and some of the anxiety, because I wanted to go in there and say, okay, here's the policy, here's what we're going to do. And then I realized I needed to pause and just hear the concern of my staff. And so we did that. And then I shared with them I have to say, I was humbled by this, because I realized in that moment, we are here for such a time as this. Where first responders do not, they're the ones that are moving towards whatever's going on, while others are backing away from it. And we needed to lean into it and engage and figure out a way to continue to provide services, because people are going to be hurting even more so because of what was going on. As soon as you take people away from the connections and the engagement that they're used to, and that you change their life that much, there's going to be ramifications, there's going to be repercussions, there's going to be people whose depression gets worse. And so I'm looking at, okay, we're asking everyone to socially isolate. Well, I already know some of the factors that are involved in dealing with depression, and you're going to exacerbate those things. So how do we continue? How do we pivot?
Right.
You know, and so that's what it became. It was a daily, because the rules and regulations were, if you remember it right then, they were changing on a daily basis.
Right.
I would articulate some policies and procedures, and by the end of the day, those would be I had to change those. But what we were not going to do is step away from it. What we were not going to do is back away from our mission, our call to help people. And so we had to, my team of clinicians at ANMID staff are just freaking amazing. They're awesome humans. And they pivoted. They did whatever it took to help people. And that's what we're about.
All I keep thinking about is the fact that for about a year and a half, we were homeschooling our children for all intensive purposes. Now, they're not able to interact with their friends. And then they may or may not have already suffered from some sort of mental health issue that you were working with.
Yeah.
And they need the interaction with the clinician. They need to spend time with you, one of your clinicians that work for you. And now they're looking at each other via a screen. How do you add the human factor in that? I just struggle with that idea, because I can imagine that this kid needs to be playing a game or what have you, interacting, and it's not happening. I want you to dive deeper into that.
Well, I go back to my amazing staff. They had to be very creative. We had to, all of us come together and how do we do this? How do we create a format? How do we be a lifeline for individuals? And I mean that seriously. Being a lifeline for individuals that are socially isolated. We're all being told to socially isolate.
Right.
How do we provide that lifeline? So we had to be very creative, and that was a day-to-day challenge, and we had to pivot. I mentioned that before, and to figure out how to do that. So there was various ways that my staff did that with both individuals, children,
Right.
and parents, and then quite frankly, professionals that receive our services.
You want to share?
Everyone was in the same boat. So there was a lot of anxiety. I remember in one of our clinical team meetings, sharing with my staff, I'm looking at, and they're talking about, flattening the curve. Remember all that stuff?
Oh, yes.
And it's like, oh, it's just going to be a couple of weeks. And I'm looking at the science. I'm like, and I told them, we're going to be dealing with this for a while. So the things that we're putting in place, we're not going to do it in a haphazard, just, okay, this is just for a couple of weeks. We have to figure out what we're going to do that's sustainable. I used that key word then. And I told them, because we're going to be living with this for a while. We had to figure out what was sustainable. I didn't want it to, I wanted to prepare my staff's mind to look at it as, how do we do whatever we're going to do in a way that is sustainable, and we're going to be able to help individuals with this in the long run. And I had no idea it would be nearly as long as what it was, but I knew that we had to, whatever we did, we're going to be in this for a while.
I talk about age and stage in our businesses, whether
It's a great concept.
as a business owner, as a patient, as a consumer. There's an age and stage that impacts our businesses and how we serve.
Mm-hmm.
The pandemic, you definitely dealt with age and stage. Let's dive deeper into that.
And children, and this is part of the thing that oftentimes goes undetected until later on, and that's the impact on children. So maybe in the moment they didn't evidence some challenges behaviorally or whatnot. When kids are upset or depressed or sad, anxious, you might see it in their behaviors, right? So you take them out of the school system, you take them away from their friends, you will have effects the next day, the next week, the next month, the next year, and then we're seeing some of those effects years after. We're seeing some of those effects years after because kids out of the school system, some of them fall behind, they're not used to that routine, that structure. Those are really important things for kids. And yes, we needed to focus on protecting people from the virus. But not political, but we missed the boat on some important things when it comes to kids and some basics that they needed in this process. And we're experiencing that now, and we're going to be dealing with the ramifications of that for years to come, I believe.
And I believe there is a follow-up statement to that. Not just the children. We as humans in general.
Yeah.
There are milestones, the ages and stages in our life where we shift and make adjustments.
Mm-hmm.
We have caused emotional and developmental delays. Moving forward, as we're looking at the next step and our continued development as humans, milestones, what do we need to look for? What are the signs when we're observing someone that should trigger someone outside of your arena? Oh, this could be a warning sign. Tell me what to look for.
Someone we care about, whether it's a friend, family member, coworker, and they're struggling with something, what do we do? So, as you point out, May is Mental Health Month. So, learn more about mental health. We have a friend, family, coworker, just being a good listener. Non-reactive, good listener, just being willing to listen, not judge, not give them advice right away. So some of that's just, as humans, we typically are not good listeners. We have to learn actually how to listen. And that is actually a skill that a lot of people do not have. So that's not the sexiest answer, but that's the truth, is just being someone who's willing to listen.
Listen, pause, before offering advice.
Well, you can ask the person, would you like my thoughts, or do you want me to just
to listen,
be available? I mean, there's nothing wrong with asking, because that's another way of respecting the individual. Most people, as long as they feel heard, then there's an openness to, what are your thoughts? What might be possible? I would say being aware, knowing that is commonplace, and knowing that there's help. So there's myriad ways that people can access interest groups. If a person likes hiking, then go hike. If the cycling, there's cycling groups. So those are resources. At the same time, often individuals are struggling with something, and if you see an individual struggling, and maybe it's affecting their functioning. Functioning is a key word, I would say, in many ways. Functioning in a relationship, functioning in daily activities, functioning at work. If it's affecting their functioning, they need help. Now, go ahead.
Non-medicinal, so far, is what we're talking about.
Yeah.
Earlier we talked about the stigma, and we talk about the science and theology and how to help. Many people say, oh, well, give them a pill. And we've seen that especially in the young children. Medicate, medicate, medicate. Everything you're advocating for here are alternatives to relying on the medicine.
Actually, it's interesting that you use the word alternative. I would say this is best practice.
Oh, wonderful.
I would say first things first, you don't throw a pill at it when, if you look at the research, these are the things that you need to do. I'm not opposed to medication whatsoever when it is needed, when it would be appropriate, when it's best practice. But if you look at the research, if you look at how we function as humans, then the first things first, you do these, you engage in the resources, you get people connected to help. At Samaritan, we provide psychological services, we provide the talk therapy, we do the relationship therapy, we do the behavioral interventions for children and their families. We do all those kinds of things. None of that involves medication. At the same time, I said I'm not opposed to medication. If you have an individual who is suffering from moderate to severe depression, you look at the research and what's best practice. A combination of medication and talk therapy is the most efficacious. But the problem is, and to your point, is people want to throw a pill at it. And because they think throwing a pill at it, that's the fastest way to do it, and that'll take care of things, right? No. The pill, if you whether it's ADD in a child, a pill never taught ways of coping. A pill has never given guidance in how to navigate challenging issues and problem solving. And again, if you have an individual that's struggling, whether it's attention deficit disorder, there's a lot of kids, you throw a pill at it, or depression. Depression and anxiety they're the common cold of mental health. Okay. People want to throw medication at anxiety, and actually, if you look at the research, if they're given an anxiolytic, so something that's a sedative, I want to make sure I'm using words that are, but a sedative, hypnotic, or anxiolytic. The problem is then, if you throw that medication, and medical doctors, I support them, they're essential, and at the same time, if they just give a pill and they don't give a referral to provide psychological services, okay, psychotherapy, then that's not best practice.
Thank you. So which comes first, the chicken or the egg? Who do they go to? Does a person seek out counseling and psychological services, or do they go to the doctor first? And then how can they ensure that you will cross over and say, now it's time to go get your meds, or now it's time to go sit with a counselor? Who, what, where, when? Tell me that.
It's an excellent question, and some of it has to do with stigma too. It's more socially acceptable to go see the medical doctor because there's something wrong and I need medication for it, and that's going to take care of it. When in reality, what they need to do is talk to a professional who works in that area. So if they, for example, a lot of people present in the emergency room with panic attacks. Okay, they think they're having a heart attack. This is a very common thing. So the emergency room doc, they go through all kinds of tests, check them out, and realize, okay, they're not doubting that they were feeling these things, but they are not having a heart attack. They're not, they're otherwise physically fine. And I want to be respectful of our fellow medical profession. What can they do in that situation? Well, medical doctors, they can't provide psychotherapy. They can prescribe a pill. And
that's
so
how they treat.
Yep, that's what they do. And so in that situation, the typical thing is to give them a sedative, hypnotic, anxiolytic, something that's going to knock down their central nervous system, right? That has an immediate calming effect. It doesn't treat the underlying issue. It does nothing. In fact, and I'm not saying that they're doing anything inappropriate. In that moment, that helps the person. They want to help the person. Of course they want to help the person, so they give them this medication. What the person needs most of all is to go see a psychologist, someone or a therapist who specializes, who works with individuals that can help address the anxiety, the panic disorder, the panic attacks. If you look at the research, what's most efficacious? What in terms of long-term success? It is not medication. In fact, let me specify, it's not a sedative hypnotic. There's a vast difference between that and a SSRI, selective serotonin reuptake inhibitor. So if the individual needs to deal with a panic attack, they need to go see a therapist, a psychotherapist that works in that area, and they can help them. There's protocols for dealing with that so they can get success in addressing that. If they get on an anxiolytic, when they get addicted to that, I would say then the individual has two challenges that they're faced with. They are on a CNS depressant that is addictive, and they have an underlying panic disorder. So then the psychotherapist has to deal with two issues, not just one. So
But before they even get to the psychotherapist, there needs to be a buy-in. They need to agree that Thank you very much, doctor, for
Yep.
giving me that pill
Yep.
in that moment.
Yep.
Now there's a next step. And now I need to go see the psychotherapist. And now I need additional help.
Mm-hmm.
The first knee-jerk reaction is, though, to see the doctor.
Yeah. We want that quick fix. Psychotherapy takes a little bit more time, but we're there to work ourselves out of a job, to help the person and help them, equip them to deal with the stuff that's going on, whatever the issue is, so that they can continue on and their functioning is restored, relationships are more appropriately dealt with, they're more able to fully work at work, that type of thing. But going back to the buy-in, that's a challenge. We're human.
Right.
Denial is a very real thing, very powerful. So if stepping back for a moment, if we look at May as Mental Health Month, if we as a society can go, okay, this is more common, this is a common thing, we just have to deal with it, mental health issues, then I would argue people will be more willing to go, oh yeah, I need to get help for this, and I'm willing to invest in myself in dealing with this. It's more acceptable. Or denial is an interesting thing because it can be due to a whole variety of things. Okay, but that's just one piece of it. That's not going to solve everything. We as humans need to go, okay, how am I going to deal with this in a way that it might take a little bit of time. It's worth the investment, though. The individual is worth the investment. I will put that plug in.
And how we invest as we are in Mental Health Awareness Month. Safe to say, education,
Yep.
listening, and treatment options.
Mm-hmm.
Really looking at all of your options as opposed to, okay, now I feel better, I'm all done. Looking at everything, looking at the bigger picture, buying in.
Yeah.
True? Is that the safe message to put out? Because our listeners today are hearing all about May and mental health awareness, and we need to give you the keys to think and know, okay, there's an issue. Education,
Mm-hmm.
listening, maybe I should say observation, because observation can allow someone to assist someone in need. True? What else would you like to add?
It depends on the level of involvement of the individuals.
Okay.
You know, as good parents, we want to be observing.
Right?
We want to be listening. And also, you know, to talk about age and stage, we need to be tuned in to the developmental processes of our children. So there's a whole host of things there, but those are some examples. So
The language we use, the milestones we reach, we've had these conversations. And this truly illustrates why you're a first responder, why we need your services. As I'm now going to reel us in and go back to the chamber. As a chamber member, how has your membership worked for you as a business?
that's a great question. You know, we do business with people that we know, that we trust. I can't think of any more important area than mental health to do business with someone that we can trust, an organization that we can trust. On a broader perspective, we want to be a part of helping the community. We want to be a part of community awareness. So I want to be I want to be a part of helping people look for options for their mental health needs. If we make it more of, okay, so that's Samaritan Counseling Center, that's Dr. Doug. Mental health is a real thing. It's not this, let's keep quiet about it. And no, we're here, we're part of a community, we're engaged in our community. Those are all important aspects. We've built such important relationships, and that, as a nonprofit, that's important because we are here for the community benefit. We can't do the work that we do unless we're engaged in the community, and the community is engaged with us. The community supports us. So, for example, our board of directors, they're leaders in the community. They're the ones that oversee the overall organization and health. So those are ways that we connect with the chamber, and that we can be a part of a community and support others. Actually, I want to say something about that. If I can be a part of helping community leaders and business leaders recognize mental health, and they can get their people in for help that they need, they will be more productive. We will have a healthier community if we have people that are willing to go, hey, there are resources here. That it's a win for the employer, it's a win for the community, and relationships in general. The more we can help people deal with relationship issues and address their mental health, that will help all of us. So,
well said. Now, I've got to turn just a little bit.
Okay.
Because it's fantastic to hear all of this. It's obvious you have the education. It's obvious that you have fantastic services to the community. What do you do? What does the good Dr. Doug do to have fun and to take care of his own mental health?
That's a really good question. I'm human first. I encourage my therapist to look at it that way, and I try to be genuine and vulnerable with him and saying, we all have good days, we all have bad days. Sometimes they can see the stress on me. So what I do is I've made a commitment. Again, we're all one person. The brain is not separated from the rest of the body. So as the body goes, so does the brain, and vice versa. If we take care of our physical body, if we take care of our physical body, if we have, eat healthy, if we exercise regularly, that's going to help our brain. Just look at I get excited about this. Look at the research, because that will help our sleep, everything. So I make a commitment to myself, exercise every day, or do something active.
And what do you do? Stop being so private. Tell us what you do.
Well, a funny thing is, this is years ago, I found myself going, I'm kind of tired. I think I'll, sit down and watch this show. And then I go, what am I doing? So I set up a treadmill right in front of the TV in the family room, and I made a commitment. If I haven't gone to the gym, I haven't cycled, if I haven't done something, I'm going to exercise. Before I sit down and become a blob, I'm going to exercise. I'm going to do something active. So I go on the treadmill if I haven't, already done something. That's a commitment to myself. That helps with sleep, etc. So, and then I get out and I love interacting. That's how we met. I love interacting with individuals. And so getting out and being active and socially connecting, that's a lifeblood. So these are not just things I got to do. I look at it as part of life. And then sometimes, you guys tease me, but I'll do some crazy things in mountain biking.
I was waiting for you to say it.
I've had people go, "Do you have a death wish?" No, I have a life wish. It's invigorating. That's all part of living life, is how I see it.
Let me tell you, as you're driving along the highway, and you see the mountain off the road, off the freeway, and you see that little path, that little trail. That's where Dr. Doug is. He rides his bike on those little trails. And we wonder, is he going to make it out today? And here we are. How many miles do you average when you ride on the street?
On the street, I mean, a typical ride might be about 25 miles. But on a given weekend, could be 30, could be 40, could be 50, could be 60 something.
I was going to say, you're definitely not sharing how much you really, really do. I mean, 60 miles, okay.
Yeah.
And then still go for a hike.
Well, I don't know about going for a hike, but then we hang out and tour the foothills. I mean, that's a great example. I wanted to take it easy, so I did 66 miles, and then we hung out and...
I wanted to take it easy, and so I only rode 66 miles. That was what he said. That's what the good doctor says. That's how he takes care of his mental health, right?
Yes.
And then he, of course, ends it with a beer.
Yes.
Yes. And your beer of choice is?
Well, I love a good stout. But, it depends. On a hot summer day, a crisp, wheat or Hefeweizen. There's a lot of good beers out there. I mean, we have some really good breweries around here. And I got a shout out to Last Name. They support us in our beer and food pairing. So those are, I didn't think I'd like beer so much until I got into cycling, actually. So, but it's kind of, it's a
exercise thing. And beer. That's the prescription for a great life.
For some, not everyone, but for some.
For Dr. Doug, for sure it is. Well, thank you so very, very much for spending some time with me. I'm truly appreciative. What is the number one thought of the day for Mental Health Awareness Month? What message, just one, do you want everybody to take away from this?
Wow. I don't have just one.
You've got to tie it down just to one.
It's the concept, I guess, that we need to, if we're going to talk about self-care, if we're going to talk about mental health, if we're going to, there's the whole notion of taking care of oneself. Let's just put it that way. The mind's attached to the body, body's attached to the mind. They're not separate things. And so looking at and addressing and tuning in to the health of the whole person is I guess what I would emphasize. And so inherent in that is being okay with taking care of our mental health and being aware of the mental health of those around us. I know that wasn't just one thing, but that's the best I can do.
We're giving ourselves permission to take care of ourselves.
Yeah.
Thank you very, very much. I appreciate the fact that you spent some time with me, and hopefully we've shed some light on a very important issue. We need to take care of ourselves and those around us. And if you need assistance, if you find that one of your loved ones, yourself, a friend needs assistance, you've observed, and you think maybe they just need a little extra help, Samaritan Counseling Center is here for you. We know that Dr. Doug and his crew serve our community very well. Thank you so much.
Thank you.